Hey guys, how are you today? Today's on schizophrenia and spotlighting. Schizophrenia and spotlighting. But before we get to spotlighting, please allow my brief prelude. As you know, I've conveniently recorded it for our mutual comfort, our mutual convenience, and our mutual luxury. And you know what? I've been around a few preludes in my years. And this one is particularly luxurious, kind of like a Rolls Royce. Yeah, sounds like this. Hold on a sec.
Hello there, my name is Robert
Now, wait a
Francis.
second.
You've stumbled on my Unconquering Schizophrenia YouTube channel.
I pulled the old
where
switcheroo.
me and the bird.
This is book 2. Yeah.
That's right. We talk schizophrenia.
The essential
This is the
schizophrenia
cut of my jib right here for reasons of my medical confidentiality.
companion.
I'm a licensed clinical social worker times 15 years. That's a lot of gabbing and chatting.
Too
I've been
much.
diagnosed with schizophrenia for a score 5 and 1. And that puts a little gray fleck in my beard.
Clean shaven today.
Thank you for joining me on my channel. Now to topic.
Schizophrenia and spotlighting. Spotlighting is known as a cognitive distortion that often presents in schizophrenia. Spotlighting, it's an underlying cognitive distortion which pushes us to the periphery of reality. Cognitive distortions, there's probably 8 to 10. It's part of cognitive behavioral therapy, and distortions are maladaptive coping mechanisms. Spotlighting, and it highly, I'm all choked up here. Spotlighting applies greatly to schizophrenia. Spotlighting is thinking that the spotlight is on you all the time. When you're in a social situation, you feel like everybody's directed towards you, and it's uncomfortable. And you know what that promotes, right? Spotlighting is the primary cognitive distortion supportive of paranoia. When we get very, very paranoid, we think we're in the spotlight and that everybody is pointed towards us in the social situation. So please be aware of that. It's a huge cognitive distortion in schizophrenia. We think we're in a social situation. We think everybody's, focused on us for whatever reason. We feel like we're in the spotlight, and then oftentimes we get very, very paranoid because of that. It's a maladaptive coping mechanism. And when you think you're the center of attention, you got to remember everybody else has their own problems, trials, travails, and they have no business to put you in the spotlight. Everybody has their own baggage that they're dealing with underneath psychologically that they don't have the time or energy just to focus on us. So if you're having that cognitive distortion, please recognize we're not the center of things in the social context. And push such a distortion out of your mind and just realize everybody else is going about their own business, and we're not in the spotlight. So that's a little ditty on that. A little ditty on spotlighting. And baseball season's ending. We got about 5 or 8 games left. The Sox are in a bit of a slump, but I hope we can make the playoffs. And me and Mike the Bird. Now wait a second. This is book 2. This is book 2 here. This one's shorter. This one's right to the point. If you want just the basics, it's pretty good stuff, I think. Okay stuff, at least. All right, thanks for joining me in the On Conquering Schizophrenia YouTube channel. We'll see you next time.